All right, good afternoon, everyone. It's February 22nd, and we are here today to just kind of talk about a COVID update, what's going on in the world of COVID, and specifically what's going on in the world of vaccines. This is an effort, I think, from the county to provide updates on Monday, Wednesday, and Friday, kind of like what we did back in March and April and May when we did it was daily for a while, then we went to twice a week, and then we went to once a week. So just a way to put more information out efficiently. First of all, let me comment on the dashboard today, and I kind of want to just go through a summary of what we found out on a hospital call earlier today. The dashboard, as we've been discussing for the last couple of weeks, all of the numbers are trending favorably on the board. We focus on the trending of the infection rate in the 14-day rolling average, and when I looked just a few minutes ago before I came in here, that number is down to 5.0%. So that means for every 100 people that go in to test, we're only getting 5 that are positive. And for those of you that remember, back in November and December, that number was into the 20th percentile. So this is significantly better. Our new infections are significantly down. We always pay attention to when the report comes out, how many new infections and what percentage that shows. And like today, I looked at the number and we had 24 new infections, which is still significant, but far down from what we had just a few weeks ago. The amount of testing going on is we are seeing less testing happening. In fact, we have reduced our hours at the Extension Center for testing and are refocusing some of those employees on vaccinations, which we'll talk about in just a bit. And then from the hospital call this morning, we talked with Wesley in Via Christi, and again are seeing very good numbers at the hospital, relatively speaking. There are still a lot of sick people in the hospital. Our dashboard today looks like we have 90 COVID patients between Wesley and Via Christi, and about 33 of them are in ICU. So it's still a significant infection rate, but much better than it was in November and December. Demographics are not changing for the hospitals. A majority of the people in the hospital are over age 60. The hospitals report that their staffing is much better today than it was a couple of months ago. Almost all of their employees who want a vaccine have received the vaccine, 2 shots of it. So they're seeing a lot better attendance at work from their staff. In fact, one of the things that the hospitals wanted us to convey was that they are back to normal operations, and they are hoping that people who have maybe been holding off on some issue with their own personal health, not COVID related, that they really want to welcome them back into the hospitals. We have felt all along that the hospitals are very safe. They've done an excellent job of managing patients in, patients out, even during times of much higher COVID rates. And especially now that the rates are significantly less, they are safe to go to, and they're hoping. What they don't want to have is a second surge of people now with cardiac issues or diabetic issues or kidney or liver issues that are putting that off, and it gets more severe. So they're worried about a second wave of that kind of sickness coming in. So they're really trying to get people to come back to the hospital and come back and get that kind of work done. Regarding vaccines, just to put us into context, we gave our very first phase 1 shots in Sedgwick County just a couple of days before Christmas, on the 23rd of December. And phase 1 was, of course, geared toward medical community, doctors, nurses, physicians around the community. We started phase 2 shots on January 22nd, so exactly 1 month ago today. And we knew going in that the phase 2 population was going to be a lot of people. We had discussion with Dr. Mins in January about who in phase 2 should be prioritized, because we knew we weren't going to get enough vaccines in to do the entire mass. And Dr. Manns, based in consultation with other physicians and medical experts, determined that we should focus our vaccinations on the elderly. And we've actually been talking since June. Someday when we get this vaccine, we're going to look at elderly and those who are compromised because they're getting hit the hardest with COVID. It's just the way it's worked out. So that's the plan we have been following since then. The county has been vaccinating. We started at 80 and above and quickly worked our way down to 75 and above and are currently serving 70 and above year old people. We pivoted last week because the governor put an announcement out that she was going to earmark some vaccines for K through 12 teachers and staff. So our health department staff has pivoted quickly. And so this week we are focusing on 70 and above and also K through 12 teachers. And that process will, with the teachers, will last at least 2 weeks before we can get a first shot into everybody, but that is our focus this week. I say this because there's a lot of anxiousness around the community, particularly within the phase 2 population group. Everybody wants the shot first. And with the number of vaccines that Sedgwick County is getting in, and our community partners too at the pharmacies and other facilities throughout the county, this is, as we have said from November, is going to be a several-month process. So not everybody gets to go first. We're going to try to do this in an orderly fashion and one that is based on public health and to do two things: to keep people from dying and to keep people away from ICUs in the hospital. And then the third thing is to try to keep the virus from spreading within the community. So that's been our focus from the beginning. Dr. Manns has been staunch on that, and that is how we're rolling the vaccine at this time. We expect this vaccination process to go all the way through spring and into summer. That's been predicted from the beginning. As vaccines roll faster in, we'll move faster when we were lucky enough to have that happen. And the county is in conversation with the state weekly about how many vaccines we can get our hands on here to ratchet up the amount of vaccinations we do. To date, the county has given almost 38,000, and this goes through today. We've given almost 38,000 shots to people. We have received about 50,000 vaccines. And remember that both these vaccines, Moderna and Pfizer, require 2 shots. So when we talk about a population in Sedgwick County available to get the shot of around 400,000, that's 800,000 shots then. So this is going to take some time. Of the first doses given from December 23rd till Saturday of last week, we have given 25,000, almost 26,000 first doses to people. We've given a little bit over 12,000 second shots to people. So those people now we consider fully vaccinated. And we will continue to move at these numbers as we go through. As you're aware, we are moving our mega site from Interest Bank Arena to the library today. So we have a lighter schedule today as the staff transitions to that new facility, and we'll have a little bit of a lighter schedule tomorrow. And then we hope that we will get back to the number between 1,300 and 1,500 vaccines a day pretty consistently as we continue to get vaccines in. So this week we are at the old library at Douglas and Main. We are also doing drive-through appointments at Wichita Transit Operations Center. Our hours starting tomorrow at the library will be 10 a.m. to 7 p.m. They were reduced today from 2 to 7 as we do the transition over. And the transit operations hours remain at 9 to 6, 9 a.m. to 6 p.m. We are vaccinating all 70-plus people, first and second shots, and all healthcare workers, first and second shots. That's the population we are serving today. That's really all I have for today. It seems like things change every week with COVID. The new thing this week is the fact that we are going to really aggressively try to get K through 12 staff done. So that's the new information. And hopefully we can stick to the plan. And then when we meet with you again on Wednesday, we'll give you every updates, and we'll give you the latest numbers of vaccinations that we've given to the public. So that's kind of the plan as we go through with this session. I don't care if we Zoom these or whether we do them in person. That's your choice as the media. We'll try to accommodate whatever you need to get the information out there. So with that, I'm here for questions, and I see Tim Kaufman's in the room. He can also be available for questions, and we'll do the best we can here.
Hi, do I say my name?
Yeah.
This is Hannah Baker with Page News. Did I mess it up? Okay. Oh, I hope.
There you go.
Okay. So, we're hearing a lot about vaccine distribution, you guys rolling out this whole process. My question was actually related to, as everything is changing on a daily basis, we're starting to kind of open up the state more. Are we going to see any changes with, restaurant and bar limitations as far as capacity and curfews and things like that?
That's possible. The current health order goes into March. The numbers and the numbers we watch, and I think that Dr. Menz pays very close attention to, are the rolling average, which I talked about. He pays very close attention and talks frequently with the hospitals about what their population is like, and then he also pays attention to vaccines. So with all of those numbers lining up correctly, we are going to talk with Dr. Menz this week later about the current health order and whether he wants to amend on the fly based on some of these better numbers that we're seeing. So I'm sure he will consider that. The fly in the ointment right now is the UK strain variant that we've got in Sedgwick County. I think he's concerned, as all physicians are concerned about that. But based on these numbers and based on how fast we're beginning to roll the vaccine, I think he might visit about that. And he probably will be addressing the commission sometime within the next week or so about that.
And then kind of just to add on to that, I know just myself personally over the weekend, seeing restaurants, especially after this patch of weather that we've had with the freezing cold temperatures, people not wanting to go outside. This past weekend, there was a lot more people outside, a lot more people going to restaurants, going out into the public, being around a lot more people. Is that something that you guys are concerned about as things start opening up, a possible more spreading happening because limitations are lessened?
I think we have talked with Dr. Menz enough to know, I think he's concerned about that. I think the hospital physicians that we talked to today are concerned about that. With restaurants and stores, the beauty of warm weather is they have outdoor capacities that they can, again, implement, much like they did in the fall, and increase their capacities, and that's relatively safe with the transmission of the virus. I think that even as we move forward with this, and Dr. Fauci has talked about this on a national level, that just because we're getting vaccines rolling, it's masks and distancing are still important. They are still our main line of defense against the virus. And you look at the population of county, we're still not even 10% vaccinated to a population that we will need to get vaccinated. I think when that number gets closer to 50 and 60 and 70%, things could change, but we're a few months off from that yet. So absolutely, I think there's concern about opening too quickly or not necessarily opening, but failing to wear masks and distance appropriately. I think that's a concern. But as far as allowing larger gathering orders and curfews, I think maybe Dr. Menz would be open to that because of the numbers we're seeing. But he's never going to advocate for reckless behavior, I don't think.
Okay, I have two more things. Is
Sure.
that okay? Okay, so the things that businesses were able to apply for to have that outdoor seating, is it still in place? Do they have to reapply for that kind of thing?
No, you're talking about the dollars there that were allowed under CARES. Those dollars have been given out. Now there is a whole new wave of federal stimulation coming in the way of dollars. We have staff right now trying to decipher what that's going to mean. And clearly, our focus on Sedgwick County has been to get businesses back open, to push the economy as best we could. So we'll use those dollars however we can to facilitate businesses being open, staying open, and staying ahead of this.
And then this is a little bit off base from, the restaurants and bar stuff. A lot of our viewers are asking questions about gas bills, electric bills that are coming in. Do you guys have any advice for that? Do you know how that's going in the county?
The county last week, the chairman last Wednesday issued a disaster declaration. And the reason that local governments issued disaster declarations is the same reason that the governor sometimes will do a state declaration. It is to access federal funds to pay for damages or loss due to an event. So this is a new one. Basically, we're used to tornadoes and floods where you have physical damages being seen, and there was some of that with the cold, but mostly it's this lingering potential for huge electric bills. So the county has done what it could, which is the chairman did the declaration last Wednesday. Last Friday, the body of the commission ratified it. And now we talk with FEMA and we go through this discussion, and hopefully we don't get impacted that way, where we won't see $17,000 and $18,000 electric bills for customers. Hopefully we'll work with Evergy and our power providers and figure out a way to manage that. And if need be, there could be some FEMA dollars there available that we are now green lighted to apply for, because we are in disaster declaration. Us and another 13 or 14 counties in the state of Kansas has done that. So we now have a green light pipeline to go through and at least ask for that money. But it's never guaranteed with FEMA. Even during tornado and flood events, that money's not guaranteed. We have to make case for it, show evidence for it, and we'll do the same thing here for the citizens to do everything we can to try to mitigate this.
And then I guess, was there just anything else that you wanted to say to residents that are kind of concerned about their bills coming up?
Well, just let us know, reach out to your commissioner, and when you actually get, I think there's a lot of angst right now because nobody knows what's going to happen, and I get that, but when you begin to see the manifestation, that when you get that bill that's astronomical, we would like to know about that, where we can then begin to build our case for some type of federal assistance to help mitigate that. Okay. Wow, this is easy. And we can do this however you, I don't know if Akeem's talked it out. We can do this on Zoom so you guys don't have to come up, but we'll do whatever we can to make it easy on you. But be glad to do it from my desk too. So, all right, guys, thank you. Why?